All right, today we're going to dive into a topic that's pretty fascinating, where ancient practice meets modern medicine, acupuncture and fertility. We've taken a deep dive into a conversation between a fertility doctor and a licensed acupuncturist to bring you a straightforward, evidence-based guide.
So here's how we're going to break it all down. First, we'll tackle the biggest thing that holds most people back. Then we'll get into how acupuncture actually works in the body. After that, we'll look at the real science and the studies, see how it fits in with Western medicine, and finally, we'll walk you through exactly what a treatment is like.
First things first, let's get right to the elephant in the room. The main thing for a lot of people when they think about acupuncture is, well, the acupuncture part. Yep, that's the big question, isn't it? A fear of needles is completely normal. In fact, the acupuncturist we learned from said she used to be deathly scared of needles herself. But what these needles actually feel like is probably way different than what you're picturing in your head.
I just love this comparison because it puts it into perspective perfectly. We're not talking about those thick needles you get for a blood draw or a shot. No way. Acupuncture needles are super thin, like a strand of hair. They're solid and flexible. Most people say it feels like a tiny little pinch, and sometimes they don't feel a thing.
Okay, so if it's not as intimidating as it sounds, what is actually happening inside your body? How can stimulating these tiny points create real physical changes? The key thing to understand is that acupuncture isn't putting a drug in your body or taking anything out. It's a physical signal. It basically tells your nervous system, hey, let's calm down. It helps shift you out of that constant fight-or-flight stress mode and into the rest and digest state, which is exactly where healing and regulation happen.
And this is where you see the ripple effect. It's a really holistic approach. The idea is to lower inflammation all over, get more blood flowing to where it needs to go, and help balance that hormonal chat between your brain and your ovaries. That's the HPO axis. And of course, a big one is bringing down those stress hormones like cortisol.
And get this, here's a super cool example of how this works. There's this one little point on the ankle that's mapped directly to the uterus. And the craziest part, modern science has actually backed this up. Using tools like Doppler ultrasound, studies have shown that stimulating that exact spot can directly increase blood flow in the uterine artery. How wild is that?
So the theory sounds great, and we've got some cool mechanisms. But let's be real. In today's world, we want to know, what does the clinical research say? This is where the conversation gets really good.
Okay, so there's this one famous study that you'll hear about a lot. It found no big difference between real acupuncture and a sham version. But here's the twist that people often miss. Both of those groups did way better than people who got no treatment at all. It kind of accidentally proved just how powerful it is to simply take time for yourself, reduce your stress, and let your body heal.
But wait, the story doesn't end there. A more recent, really solid study looking at acupuncture and IVF found something pretty incredible. The group that got acupuncture had a 55% higher rate of live births. I mean, wow, that's not just a little bump. That's a massive, clinically significant result.
So when you boil it all down, here's the bottom line. Acupuncture is considered very, very low risk. In medicine, the first rule is do no harm. The data we have suggests acupuncture is safe, and on top of that, it carries a really significant potential for a lot of good.
And all of this leads to a really powerful, modern way of thinking. This isn't about Eastern versus Western medicine. Not at all. It's about understanding all the options on the table and building the absolute best support system for your own health.
I just love this quote because it nails the philosophy perfectly. The fertility doctor and the acupuncturist both agreed the journey can be so tough, physically and emotionally. So the thinking is, why wouldn't you want to use every single safe and effective tool you can get your hands on?
Now, if you're thinking about trying this, finding the right person is everything. Of course, you want someone with a lot of experience, but even more important is finding someone who really specializes in reproductive health. You want someone who gets your cycle, understands the meds you might be on, and can basically speak your language.
Okay, so you did it. You found someone great and you booked a visit. Let's pull back the curtain so you know exactly what happens when you walk into that treatment room. No more mystery.
So a typical visit is very personalized. It always starts with a good chat, checking in on your cycle, how you're feeling, all of that. Based on that conversation, your practitioner designs that day's specific treatment. Then comes the best part. You just get to lie down and relax for about 20 or 30 minutes. Afterward, they'll give you little tips, like maybe not running to a super stressful meeting right after, to help the benefits last.
Now, one thing that's super important with acupuncture is consistency.
For just general reproductive health, the usual recommendation is about once a week. This lets the practitioner support you through every phase of your cycle. But if you're doing something more intensive, like getting ready for an IVF retrieval, that might ramp up to twice a week to really maximize all those calming, anti-inflammatory benefits.
At the end of the day, all of this is really about empowerment. It's about understanding there's no single magic bullet, right? It's about building your own personal toolkit and your own trusted team. Whether that's acupuncture, nutrition, or modern medicine, every single tool you learn about gives you more power over your own health journey. So the real question is, what's the next tool you're going to explore?